Hello, today Group 1B will be talking about the recent groundbreaking accelerated approval of Lecanemab for the treatment of Alzheimer's disease. On January 6th, the FDA granted accelerated approval of Lecanemab for the treatment of Alzheimer's disease. It is the second drug aimed at targeting the fundamental pathophysiology of the disease by reducing amyloid plaques that have been associated with the loss of neurons, resulting in a reduced ability to remember and think. This represented a monumental moment in the ongoing fight to fight Alzheimer's disease, which affects millions of Americans. The accelerated approval pathway is for drugs that treat serious conditions where there is an unmet medical need. The drug must have been shown to have an effect on a surrogate endpoint that is reasonably likely to predict a clinical benefit to patients. Researchers evaluated Lecanemab's efficacy in a double-blind, placebo-controlled study of 856 patients with Alzheimer's. The Lecanemab group had a statistically significant reduction in brain amyloid plaque compared to placebo. The approved dose is 10 milligrams per kilo given intravenously every 2 weeks. However, there were some side effects associated with Lecanemab, including infusion site reactions, changes in blood pressure, and brain bleeding or swelling. The FDA will make a full decision on approval in July. Alzheimer's is the sixth leading cause of death among U.S. adults and is even higher in those aged 65 and older. In 2020, an estimated 5.8 million Americans had Alzheimer's disease. This number is projected to nearly triple to 14 million people by 2060. In 2010, the costs of treating Alzheimer's disease were projected to fall between 159 and 215 billion. By 2040, these costs are projected to jump to more than 500 billion. Death rates for Alzheimer's disease are increasing, unlike heart disease and cancer death rates that are on the decline, and are often even underreported.
Okay, so now we're going to talk about the impact of lecanemab approval on public health. So by targeting the underlying process of Alzheimer's disease and not just the symptoms, lecanemab has the potential to increase both the duration and quality of life. However, as of right now, it is only approved for mild cognitive impairment or mild dementia stage, and there is no data either for or against the use in other stages of the disease. One monumental barrier to access for this drug is the cost of $26,500. And to make things even trickier, the Centers for Medicare and Medicaid Service, commonly known as CMS, has denied coverage for lecanemab unless a patient is enrolled in a clinical trial. This will severely limit the amount of patients that are able to afford the medication, especially those living in rural communities. The CMS also stated that it will cost billions of dollars to provide coverage for the millions with Alzheimer's disease, and the current evidence is not strong enough to prove that the medication benefit is worth the cost. And finally, it would also take time to ramp up the manufacturing, distribution, and administration processes necessary to provide access to the desired population. And also, many healthcare professionals have also called into question the safety profile of lecanemab, as 3 patients died during treatment in the RCT. From a pharmacist's perspective, there are several ways to get involved. Despite the controversies and high cost, we hope that lecanemab's success will open the door for more research that would allow individuals suffering from the disease to have more time to participate in daily life and live independently. With CMS denying coverage of lecanemab, it is financially out of reach for most people to receive treatment. So as pharmacists, we can help support the initiatives to help get full approval for this medication, so that patients could be able to afford this therapy and slow their progression of Alzheimer. Pharmacists can also play a role in the management of patient Alzheimer by providing screening services to patients. These may help to catch the disease in early stages, allowing more patients to fit lecanemab's indications. And finally, pharmacists across the country can advocate by raising awareness and educating the public about improved access to diagnosis and care planning for individuals living with Alzheimer's. And we can do so by providing resources such as the NIA, Alzheimer-related Dementias Education and Referral Center. And that's it. Here's our bibliography. Thank you for listening and have a nice day.